Okay, so did everybody just get a study guide? I posted.
Yeah, I got it.
Yes.
Okay, cool. No problem. Okay,
Yes, I
so
got it.
yeah, I'm not finished with all your pharmacology meeting. Okay, probably we're gonna do the review on Tuesday. Okay, I will need some time. So today we are gonna review for the quiz. Okay, we're gonna practice with the quiz. All right. So at least we will review something. Okay, the study guide. Wait, let me. Oh, what happened? Oh shit. Okay, this is a study guide. Can you see it?
Yes.
Yes.
Okay, good. All right. So the question number one, I will try to finish it sooner. Okay, that's why I will let you guys go. Okay. Either way you have time can study or either way you can just take a break. Okay. I know you're tired. All right. The question number one. Patient have a
I have
liver
a
disease.
quick question. Is this
Yes.
stuff for the midterm or is this for the quiz? I'm confused. I thought this was for the midterm.
Both.
Oh, so
Both.
the quiz on Tuesday is based on this, not endocrine?
No, the endocrine is going to be anatomy physiology, so I'm gonna prolong it. Okay, so
Okay.
yeah, endocrine is gonna be it's gonna be the next time. So let's pay attention, focus on your midterm first, okay? Because I don't want you just doing bad in your midterm. Midterm is a big chunk, 45%. Okay, that's why let's not feel it. All right. So that's why the AMP we can do it another time. AMP usually is not going to be that so difficult, so it should be okay. Are we agree? All right.
Yes.
Yes.
Okay, so let's pay more attention on midterm. Okay, I'm also worried about your midterm. All right, the question number one. The patient have a liver disease, so how can we administer with the medication? Well, I should say, before we give the medication, so the patient already have a liver disease. So what should we do?
Monitor liver function test?
We can monitor liver function test, yeah, but that's before. So we should do the liver function test first. So usually a liver function test is a what? What function test? It's a lab. It's a lab, right? We draw the blood, right? So what kind of like a liver function usually we're looking for? We still remember? It's ALT and AST. Still remember?
Yes.
Yes,
Yes.
that's liver enzyme. Okay, liver enzyme. If the enzyme is increasing, that means the liver function is doing bad. That's why enzyme is increasing. Okay? All right. Question number two. How is the alcohol interact with the medication? Any organ effect? Can we just take in the alcohol with the medication?
No.
No,
No.
right? So how about if a question showing you, okay, this patient actually have some kind of like alcohol use history. So what should we monitor? What should we do if we give you the medication? Especially if I give some special medication like TB medication, like a statin medication, or like antibiotic. Okay, they're significant with liver toxicity, hepatotoxicity. Okay, I think I actually just tell you the answer.
Okay. We got it.
Okay. Number three. Before the antibiotic, so what nursing intervention should we do first?
Obtain
Yeah,
cultures?
obtain cultures.
Yes, good. Okay, culture. Okay. So, what use the antiviral medication to treat the coronavirus? Well, it's a virus infection, right? That's why, of course, we use the antivirus medication. So I should asking you the antivirus medication, how we do to the coronavirus. How is that affected? The mechanism.
So it just subsides the symptoms?
Inhibit viral replication, reducing the
Yes. Yeah, Bryce said a very good idea. So, is the antiviral medication we can totally kill all the virus? Can we kill them?
no.
No, no.
reduces it.
We can reduce, but most likely we can kind of limit their activity. We can limit the virus activity, right? So when the virus activity is decreasing, that's why the symptom will get better, and then the immune system actually can conquer. Right, immune system can just helping you and healing with this kind of virus infection. So that's why antiviral medication, not like antibiotic. So we cannot actually kill the virus. We just limit the virus and their activity. Okay. All right. Number 5. Number 5, this question, I have to say I'm sorry, okay, because I kind of forgot. And also, Paxlovid, this COVID-19 medication, is in the N class right now, okay, but it's not in our textbook. So I saw the ATI, that's why I find out, oh my God, yes, this is the N class. That's why we have to include it. So that's why I put all the information here, okay. It's not in your PowerPoint, that's why I put it here. So the Paxlovid, this medication, the knowledge, okay, is a COVID medication. So this Paxlovid, I have a 3 question, 5, 6, 7. Okay, 5, 6, 7. So here, Paxlovid knowledge is that the first thing is when we take the Paxlovid, it will test like a metal. Okay, the testing, you'll feel like testing like a metal. All right. So the testing is where is affect to your testing, and also will cause a diarrhea. Easy. So COVID is causing a diarrhea, and Paxlovid also causes a diarrhea. So that's why the patient was telling you, okay, when I'm taking the medication, I still have a diarrhea. So your education will be like, okay, yes, because this medication also will cause a diarrhea. So we don't know if your symptom is getting better by the COVID virus or not, because they both cause a diarrhea. This is one of the side effects. But it doesn't just affect to your health. Just drink some more water. All right. And the Paxlovid, the treatment is for 5 days. Okay, the doctor will order the Paxlovid. This is only for 5 days. And it's a combination medication. It combined with 2 antivirus medication. Okay. So this is using is kind of like a twice daily, in the morning and in the evening. So you have a 3 tablet. Okay. The 2 pink tablet is nirmatrelvir. Sorry, it's very difficult to read it. And another one is nitronavir. Okay, the white one. So it's a 2 pink one with 1 white one. Okay. But the majority is a daily and a night. So twice a day, 3 tablets. And we treat mild to moderate COVID symptom. Okay, remember this, mild to moderate COVID symptom. That means what? If a severe COVID symptom, can we treat with a Paxlovid? No. Severe COVID symptom patient need to go to hospital. Paxlovid is not working at all. So severe COVID symptom, the patient need to use the IV, the acyclovir, okay, antiviral medication, the acyclovir, IV medication. So the pill medication, Paxlovid, it just only uses like a mild to moderate. The patient still quarantine at home, not in the hospital. Okay, for adult, of course, you can use. For the children, usually we use like over 12 years old. So if a children under 12 years old, the pediatric doctor may switch to other antiviral medication, not a Paxlovid, Okay, and do not immune the virus. That means what? This is not a vaccine. This is not a vaccine. So when a patient tell you I take a Paxlovid, then I won't get a COVID anymore. No, this is not a vaccine. You still need to get a vaccination, okay, yearly. Okay, so it's not an immune for the virus. Okay, this is a Paxlovid with all the knowledge here. So let's see the number 6, the question. Contraindication of a Paxlovid. What kind of contraindication of Paxlovid we need to know?
Severe renal or hepatic impairment?
Yes. Yes. Well, hepatic, I would say most of like is a hepatic. Renal, yes. Also, we have some research about the renal, yes. Okay, and also see here.
Yeah, Daddy did that.
Also, here, contraindication, also for the children below 12 years old, we do not use it. Okay, and also another one, okay, contraindication, if a patient have a severe COVID symptom, okay, so that means Paxlovid, we don't use it. This is also contraindication, okay? All right, and then the common side effect of a Paxlovid. Here.
Metallic taste.
Metallic taste,
Diarrhea,
and also
diarrhea.
diarrhea. Yeah, also diarrhea.
Hypertension.
Hypertension, okay, usually is not a big concern. Usually is not. Okay, so test like a metal. That's why patient was just changing the test. Because remember, one of the COVID symptoms is that the patient they will lost their sensation of a testing. Okay, but this medication tests like a metal. So that's why a patient will tell you, okay, my God, I'm permanently lost my test because of COVID. But the patient will tell you, I test like a metal. So that's why you need to tell the patient, say, no, it's not. You test like a metal because this is medication. Is this because this is medication? It's not because of the COVID effect to your test. So you are not losing your test. No. And also diarrhea. Just tell the patient, you're taking this medication, that's why you have diarrhea. So when this medication finish, 5 days later, your diarrhea should be kind of like getting better. All right. And number 8, inhalation anthrax, the first line treatment. Okay, I just give this answer directly because I forgot to put in the PowerPoint. Okay, so that's why the anthrax is a bacteria infection, and most likely is a spore. Okay, that's why we need to use an antibiotic to target the spore. So Cipro, this medication is target with the spore. So that's why the first line treatment usually for the anthrax is the Cipro medication. Okay, so I will need you to remember this, okay? Because this is the one I forgot to put on your PowerPoint. When I saw the ATA, then I find out. Okay, but here, this is one is in your PowerPoint, okay? So the Cipro recommendation, the treatment duration, how long we use this antibiotic to treat the anthrax?
60 days?
Huh?
60 days.
60
Yes,
days?
60 days. 60 days. Good. Good. Okay. That means at least we need to use 60 days. So no less than 60 days. Below 60 days, no. Okay, over 60 days, yes. So sometimes the patient will use like 90 days, like 3 months, okay, because the anthrax is very difficult to treat. So that's why we have to use at least 60 days. All right? All right, let's go to our superstar medication, TB drug, okay? Isoniazid treatment is for what? For the TB, right? For the bacteria, right? But how this medication is treating for the TB bacteria? Can we kill them? Can we kill
Is
this
it for
bacteria?
active?
Huh?
Is it for active TB?
It is a progress TB. It's happened already. It's diagnosis already. So we treat the TB. Yeah, but is a TB medication can kill the TB bacteria? Can we kill it? Remember in the class I say it's very difficult because TB will making some kind of like a surface, the memory to protect themselves just like their own castle. Okay, so this is the reason that's why the medication is not very easy to kick in to kill them. Not very easy. But why we use this medication?
To suppress it?
Suppresses and also inactive. Also inactive the bacteria, their activity. Okay, so that means usually some kind of like antibiotic we can kill the bacteria, right? But because TB, this bacteria is so small, they're so small and small, they hide in your alveoli. Okay, and also making it like a membrane, the surface, to protect themselves. So if I want to kill this bacteria, I also need to kill your lung, right? If you don't have lung, how can you breathe, right? So this is the reason we use a TB medication. Why we need to use it for the lifelong? Because I want to make sure the TB, the bacteria, never, ever comes out. Never. So that's why I want to make sure inactive with the TB bacteria. Okay, so we just use isoniazid, this medication, but all the TB medication have this kind of function. Okay, I will make sure the kind of inactivity for the TB bacteria. This is the treatment we're looking for. Okay, isoniazid reporting the tingling. So what happened? And what should we do? Okay.
Peripheral neuropathy?
Yes. Because what? We need to give something that will be helping.
Vitamin B.
Vitamin
6?
B.
B6.
Vitamin B6. Vitamin B6. Okay, so when we give our vitamin B6 and the neuropathy is going to be improved. So that's why this is the reason isoniazid, this medication, will combine with the vitamin B6 together. The patient will swallow two pills together. Okay, all right. This is another medication, also a TB medication, pyrazinamide. Pyrazinamide is used, also alcohol use. Okay, what will happen?
Hepatotoxicity risk.
It's going to cause liver failure, right? Because this medication is going to be cause like a liver toxicity already, and you're still drinking, right? You're still drinking. So if you're drinking, also taking this as a medication, and I'm sorry, I think your liver is going to be die so soon, right? So that's why we need to monitor the liver and also tell the patient, okay, please do not use alcohol when you're taking this medication, and especially if you are TB already, why you still drink, right? Okay, so rifampin education. What happened to this rifampin medication when we take it?
Body fluids turn orange.
Yes. Orange body fluid. Okay, will turn to orange color. All right. How about the rifampin taking with the oral contraceptives, the birth pill? What will happen?
It won't work.
It won't work. Yes. So you will accidentally get pregnant. Okay. And we don't want it because rifampin have some kind of toxicity. It's going to also toxic with your baby. So that's why don't get pregnant. Okay. So that's why use oral contraceptive is not working. That's why you use another way. Okay, to prevent having a pregnancy. All right. I don't know how to read this medication. Acebutol with the lab. Okay, this is also a TB medication. What kind of lab we are looking for?
Vision.
Lab, drawing the blood. This is easy, just like the way we say hepatotoxicity, right? So that means we're checking the liver.
LFTs.
Yes, liver enzyme. Okay. All right. Penicillin allergy before the pneumonia treatment. Okay, so what kind of like a test we do before the treatment? Please. Do you see my forearm?
Test. An allergy skin test.
Yes.
Allergy test.
Yes. Allergy skin test. Skin test. Okay. So if you have a penicillin allergy, you could have lots of antibiotic allergy. Okay. So that's why we go to like the allergy doctor and do the skin test and see if you use other medication, it's going to be cause allergy or not. All right. Antibiotic to treat the empyema. I forgot this question. What did I do with this question? Oh, probably is how we just treat the empyema with the antibiotic. What is the empyema? It's a pleura between the
Infection.
space.
Little
Yes, the fluid get infected,
Right.
right? It's get infected. That's why we use the
Oh, yeah.
antibiotic. Huh? Yes.
Antibiotic plus drainage.
Yes. So we use it to treat because it's an infection already. Okay, it's infection already. So it's not kind of like helping improve with the fluid drainage, or not just helping like improve the cardio function. No, the antibiotic is treating for the infection only. Okay. Opiate therapy with constipation. Okay, so if we just patient have a pain, okay, they taking the opiate medication, like a pain medication, with a constipation, what should we do? This one should be easy.
Stool softeners.
Stool softeners.
Stool softener and what else?
And the fluid increase the
Increase
Drink
fluid
lots of
and the
fluids.
fiber.
And also fiber. Yes, yes. Bryce said the answer. Bryce, he said the answer already. All right. Pulmonary embolism, heparin and warfarin use. Okay, so we're going back to the warfarin and also heparin use together. So what's the purpose we use both medication in the same time? This time we are talking about pulmonary embolism, but it's a blood clot. It's the same. Different disease, but use the same medication. Well, because the heparin will kick in first, right? Warfarin will wait at least like 5 to 7 days. So that means what? So we take this both medication. Actually, we are waiting for the warfarin, the effect kick in. Then we can suddenly discontinue the heparin. Okay, before the warfarin medication, the effect. That's why we still need to use a heparin to prevent the blood clot, more blood clot formation. Okay, all right. And the pulmonary embolism. Okay, before the anticoagulant, what exam should we order?
INR
Angiography.
for heparin.
It's a
I didn't
angiography.
say heparin, but you're doing a very good guess. Okay, yes, we probably need to just check like the lab the lab, right, like a PT, PTT, and something like this, right? But before, okay, this is we take in the anticoagulant. That's why we check it. We check PT and PTT before we take it. Well, I haven't taken it, so I need a diagnosis exam. Diagnosis exam. So that means what? I need to make
Ultrasound?
sure it's a,
CT?
yes, CT scan. CT scan. Okay. X-ray and CT scan. But the answer doesn't have an X-ray. That's why we have a CT scan. All right. So these are all the 20 questions. Okay. I make one more. Okay. So anticoagulant with the herbal medication. You still remember?
No.
Some herbal medication, no. Like what?
Yeah, 4G, the ginseng,
Oh yeah, the
the
4G.
ginkgo.
Yeah.
John's Wort, is that one? Or something John's Wort or
John's
something.
Wort is
Yeah.
counting, but it's not 4G yet. So I haven't talked about John Wort yet. Yeah, don't remember this one yet, not yet. Okay, just 4G first. Okay, 4G.
Yeah, ginseng. And
Oh,
then ginkgo.
and
And then
I have two more.
Garlic?
Got it? One more.
Garlic.
Ginger?
Ginger, yes. Okay, ginger, yes. This is 4G. Okay, will affect to your anticoagulant will cause even bleeding more. Okay? All right, any question?
it's okay.
It's okay? If no, I'm gonna let you go. Okay?
No, thank you.
Okay.
So we'll do the rest on Tuesday.
Yeah, we'll do a reset on a Tuesday. Okay. Yeah,
Okay.
just pay your attention, study this one, and also with your message one first.
Okay. Thank
Okay,
you.
thank you.
Okay, no
Yeah.
problem. Good luck.
Yeah, appreciate it Sunday. Thank
Okay,
you.
no problem, and get some rest. Okay.
Thank you.
Do.
Sorry, Patrick,
Uh.
when is the quiz for this one?
This one is gonna be this quiz is gonna be on Tuesday. That's why
On this
I
Tuesday?
reviewed. Yeah, that's why
Okay.
I'm doing. Tuesday, okay,
Okay,
Tuesday.
Okay, perfect. Thank you.
Stop sharing. Okay.